Hello and welcome to Bite-Size MRCP, a manageable way to digest the things that you need to know for your MRCP exam. We are two junior doctors based in the UK who have passed all three parts of the MRCP within the last 5 years and want to help you do the same. We're not associated with any MRCP examination organizations, and the materials covered are by no means an exhaustive list of what can come up in your exam, and indeed are not intended to be used as medical advice. Please refer to your College of Entry or your friendly supervisor for further questions regarding the exam and syllabus. If you like the sound of what you hear today and would like to join us for more bite-sized revision, give us a thumbs up and press the subscribe button. Now, without further ado, let's get into today's topic, which is on gram-negative bacteria.
So now let's try a question. Which serogroup of Neisseria meningitidis is commonly associated with outbreaks in adolescents and young adults, particularly in college dormitories and military barracks? So our options are serogroup A, serogroup B, serogroup C, serogroup W, or serogroup Y. And the correct answer in this case is serogroup B. And you'll remember this from an earlier slide which discussed the various serogroups and their prevalence in various populations. And this is quite a common scenario that might be talked about in an MRCP question, and so it's worth remembering this. So now let's try a question. A 23-year-old male presents to the clinic with a 2-day history of painful urination and purulent urethral discharge. He admits to having unprotected sexual intercourse with a new partner 2 weeks ago. On examination, you note a clear discharge from the urethra. A gram stain of the discharge shows gram-negative diplococci. Which of the following is the most appropriate initial treatment for this patient's condition? So these are our options. We have oral azithromycin alone, intramuscular penicillin, oral doxycycline and intramuscular ceftriaxone, intramuscular ceftriaxone and oral azithromycin, or intramuscular ceftriaxone alone. So you will remember from the presentation that it's important to try and treat coexisting potential STDs. So we do need to treat both Neisseria gonorrhoea, which is indicated by this vignette, as well as the other common STD, which is chlamydia. Given all of this, the correct answer in this case is D. So let's try a question. A 55-year-old man presents to the emergency department with severe abdominal cramps, bloody diarrhea, and a low-grade fever. He reports eating a hamburger at a local restaurant 2 days previous to the onset of symptoms. A stool sample is positive for E. coli. Which of the following strains of E. coli is most likely responsible for his symptoms? So here we have the 5 different types we spoke about before: E-tech, E-pec, EIEC, E-hec, and EAEC. The most likely cause here is E-hec, particularly because of its association with undercooked beef, and in this case the patient has eaten a hamburger recently, and that is the most likely source of his infection.
Let's do some questions. A 65-year-old woman with diabetes mellitus is admitted to the hospital with symptoms of high fever, chills, and flank pain. She has a history of recurrent urinary tract infections. A urine culture is positive for Klebsiella pneumonia, which is found to be resistant to multiple antibiotics, including third-generation cephalosporins. Which of the following is the most appropriate initial treatment for this patient's infection? A. Oral trimethoprim sulfamethoxazole. B. Intravenous ceftriaxone. C. Oral ciprofloxacin. D. Intravenous meropenem. E. Oral amoxicillin. So this is quite a standard case of somebody coming in with a history of UTIs, coming in with what sounds like another urinary tract infection that is positive for Klebsiella pneumonia. It has previously been found that it's resistant to third-generation cephalosporin, and if you remember, we did discuss that oral amoxicillin is not going to be good enough in the cases of Klebsiella. Therefore, options B and E would be incorrect. Option A is also incorrect given the fact that this patient is clearly very unwell and in sepsis. So you would need to be opting for something that is intravenous, and therefore option A and C would be incorrect. And even if you hadn't known this, by choice of elimination, you should be able to get to option D, which is intravenous meropenem. Let's do some questions. A 68-year-old man with a benign prostatic hyperplasia develops urinary frequency, urgency, and flank pain. Ultrasound reveals renal calculi. Urine culture grows Proteus mirabilis. Which characteristics of Proteus mirabilis is most relevant to the formation of renal calculi in this patient? Option A, production of endotoxins. Option B, motility due to flagella. Option C, urease production. Option D, lactose non-fermentation. Option E, gram-negative bacterium. If you were paying attention, you would realize that the key factor that results in Proteus mirabilis making through-white renal calculi is its ability to produce urease. Therefore, option C is the correct option. Let's do some questions. Question 1. A 25-year-old female presents to the clinic with a 1-week history of fever, abdominal pain, and diarrhea. She recently returned from a trip to Southeast Asia. Blood cultures are taken, which grow Salmonella typhi. Considering the regional antibiotic resistance patterns, which of the following would be the most appropriate initial antibiotic therapy? A. Oral ciprofloxacin. B. Intravenous ceftriaxone. C. Oral amoxicillin. D. Oral azithromycin. E. Intravenous vancomycin. And if you recall, we discussed that the options for treatment of Salmonella typhi at the beginning is either with oral fluoroquinolones or intravenous ceftriaxone. Therefore, the correct option among these will be option B, which is intravenous ceftriaxone. Let's do some questions. A 30-year-old man presents with a 4-day history of high fever, mild abdominal pain, and lethargy. He recently returned from a trip to Southeast Asia. On examination, you notice a few faint pink spots on his abdomen and lower chest. These spots are slightly raised and disappear on pressure. Given the description, what is the characteristic rash associated with Salmonella paratyphi infection known as? Options are erythema multiforme, option B, erythema marginatum, option C, urticaria, option D, livido reticularis, and option E, rosy spots. If you were listening, you would realize that this is classically describing the characteristics of rosy spots, which are these faint pink spots typically affecting the abdomen and lower chest. They are slightly raised and they classically disappear on pressure. So the correct option is going to be option E. For those of you who may not be familiar with the other options that are described, you would be able to click the link here for our sections under rheumatology and dermatology, in which we will be talking in a lot more detail about option D, which is the net-like rash that affects the skin and is associated with a few classic rheumatological manifestations, which you certainly need to know for your exams, and option A and B, which is classically affecting the skin in a few of the classic dermatological manifestations. So please feel free to refresh your memory by looking at our previous library information on rheumatology and dermatology. Let's do some questions. Question 1. A 25-year-old man presents to the emergency department with symptoms of fever, diarrhea, and abdominal cramps. He reports eating undercooked eggs at a brunch 2 days earlier. A stool sample is positive for Salmonella enteritis. Given the source and presentation, which of the following is the most appropriate course of action for managing his symptoms? A. Provide supportive care with oral rehydration salts and monitor closely. B. Prescribe oral ciprofloxacin. C. Administer intravenous fluid and recommend bed rest. D. Start intravenous ceftriaxone immediately. E. Prescribe oral metronidazole. If you recall, this is a case of Salmonella enteritis in a gentleman who is not elderly or immunocompromised as far as the history is concerned. Therefore, no antibiotic treatment is recommended, and you would be recommending him to have supportive care, which is oral rehydration salts and monitoring. Let's do some questions. During a public health investigation, an outbreak of Shigella dysentery is identified in a community with limited access to clean water. Which of the following interventions is most likely to reduce the spread of the infection in this community? A. Mass vaccination of the community against Shigella. B. Distribution of oral rehydration solution. C. Provision of clean water supplies and promoting hand hygiene. D. Quarantine of affected individuals. E. Increasing the dose of chlorine in the local water treatment facility. And if you were paying attention during the talk, you will realize that most of the cases of Shigella are actually self-terminating and do not require any antibiotic. However, to stop the spread of this, it would be really important to stick to the basis of management of infectious diseases, which would be option C, which is provision of clean water supply and also promoting hand hygiene. Let's do some questions. In the context of a bubonic plague, which vector is responsible for spreading the causative bacteria to humans, and what characteristics behavior of this vector facilitates the transmission of the disease? A. Mosquitoes with their blood-sucking behavior. B. Ticks with their prolonged attachment to hosts. C. Fleas with their contact with infected tissue. D. Fleas with their habit of jumping from infected rodent to humans. E. Lice with their close contact with human skin. If you recall, you will realize that in the context of bubonic plague, the way that this is transmitted is through flea bites, which is making the option D the correct option, which is their habit of jumping from infected rodent to humans. Let's do some questions. A 35-year-old man presents with right lower quadrant abdominal pain, fever, and diarrhea. He is diagnosed with Yersinia Enterocolitica. Considering his symptoms, which of the following is the most appropriate initial management approach for this patient? A. Immediate surgery to remove the affected section of the intestine. B. Oral rehydration therapy and symptomatic treatment. C. Start intravenous antibiotic immediately. D. Administration of antidiarrheal medication to reduce fluid loss. E. Intravenous corticosteroids to reduce intestinal inflammation. So if you recall, this is a case of a gentleman who is not particularly at risk, as in he's not elderly and he doesn't have any history of immunosuppression. He's presenting with quite classic symptoms of Yersinia Enterocolitica. Recall that the correct management in here would be actually supportive, and there is no indication to start antibiotic in these cases with the current information that you have in front of you. Therefore, the correct option is going to be option B, which is oral rehydration therapy and symptomatic treatment. We have already discussed why option C and option A are not going to be correct. It might be tempting to pick option D as a way to reduce fluid losses. However, don't fall into the trick that you would want to be using antidiarrheal medication in someone who has an infectious diarrhea. Remember, the goal is to actually let the patient have the diarrhea so they can get rid of the toxins that are produced in the intestine while you are supporting them with intravenous fluid and electrolyte management. The risk of giving somebody like him antidiarrheal medication is that the toxin can get built up in the bowels and it could potentially lead to toxic megacolon, which is a surgical emergency. And option E is completely incorrect. Corticosteroids do not provide any benefits in somebody who have an active infection outside of the context of intensive care unit. Therefore, giving him corticosteroid, you're just dampening his immune response and potentially causing thinning of the intestine and actually worsening the inflammation. Let's do some questions. A 60-year-old man with a history of COPD is hospitalized with a respiratory infection. His sputum culture grows Pseudomonas aeruginosa. Which factor makes treating infections caused by Pseudomonas aeruginosa particularly challenging? A. The rapid onset of symptoms following infection. B. Its ability to survive in an anaerobic environment. C. The production of a protective biofilm. D. Its rapid rate of replication. E. The tendency to cause asymptomatic infection. If you were paying attention during the session, you will realize that the correct option in here would be option C, which is the production of the biofilm that gives it this particular unique feature to make the treatment of Pseudomonas infection particularly challenging. Let's do some questions. Which feature of Burkholderia cepacia primarily contributes to its notorious reputation in hospital setting? A. The rapid growth rate. B. The ability to form biofilm. C. High virulence in healthy adults. D. Ease of eradication. E. Sensitivity to disinfectants. Recall that the correct option in here would be option B, which is Burkholderia cepacia's unique ability to form biofilms, which unfortunately adds to the challenge and complicates the treatment for those patients who have been infected with this bacteria.
So let's do a question. Which of the following statements about Bordatella pertussis is correct? Bordatella pertussis is a gram-positive bacterium responsible for causing whooping cough. The catarrhal stage of Bordatella pertussis infection is characterized by severe coughing fits and inspiratory whoop. C. The pertussis vaccine is a live attenuated vaccine given as part of the DTaP immunization. D. Nasopharyngeal swab culture is considered the gold standard for the diagnosis of Bordatella pertussis infection. Or E. The first-line treatment for Bordatella pertussis infection is coamoxiclav. So the correct answer here is D. Nasopharyngeal swab culture is the gold standard for diagnosing this infection. So let's try a question. Which of the following is a characteristic finding in Legionnaire's disease? A. Transmission is primarily through direct contact with an infected person. B. The disease often presents with a dry cough but no fever. C. The most rapid diagnostic test is the urinary antigen test. D. The preferred treatment includes amoxicillin. Or E. Pontiac fever is a more severe form of Legionnaire's disease. So if we go through these answers in turn, part A is wrong because we know that transmission is through water droplets rather than direct contact with an infected person. B is also wrong because Legionnaire's disease does usually have a fever. C is the correct answer, and you may recognise this from your own clinical practice, that urinary antigen tests are used to rapidly diagnose Legionnaire's disease. D is also incorrect, just to complete these answers, because the preferred treatment is erythromycin or clarithromycin and not penicillins. And Pontiac fever is actually a milder version, not a severe version of Legionnaire's disease.
Thank you for listening to this episode of Bite-Sized MRCP. If you like what you've heard today, give us a thumbs up and hit the like and subscribe button below to make sure you don't miss our next episode. Let us know in the comments which topics you would like to hear in future. See you in our next episode.